So it's 6:30 right now. I got admitted. I'm just in the what is this called? Surgical daycare admission room, just waiting for them to call me in or something like that. They told me that the surgery would end at noon. So just waiting, and I'm hungry. I'm tired. My head hurts. I just want to get this over with. Hey, I'm freaking out a little bit right now. I'm about to go into the surgery. They gave me some dexamethasone, some antibiotics, cefazolin. Got the IV put in. I saw the anesthesiologist and the surgeon. The surgeon said that it'd be a good idea to move my genial tubercle. So they cut a square in my chin and move it forward and nail it instead of just doing the sliding genioplasty. So I hate this so much. I hate this. Who the hell am I? Look at the dark lines under my eyes. I'm so tired.
I think you're just really slow.
Oh, it's gonna get even worse. Hey, it's the 28th today. Yesterday sucked. I'm swollen, you can see. I don't feel great. But I'm on some good drugs. They want to send me home from the hospital, but I like it here. I don't know if I'm ready to go home, because I'm not eating that much. I can barely push down a few meals at a time. Just water and apple juice. Everything is hard, and I'm on some morphine, some ketorolac, some Evan, some antibiotic and stuff. Pains between 3 to 5. If it gets 4 to 5, I ask for drugs. Get back down to 3. This sucks. What did I sign myself up for? The sleeping was not that great. Swallowing is very hard. I have to pay close attention to swallowing so I don't choke. Sleeping, like, my nose is pretty plugged up. The nose was open right when I woke up, but just gradually got more plugged and congested. And it starts bleeding every time I stand up. I have a suction from the mouth. There's not too much blood in my mouth. Or you're getting lots of dexamethasone too, like 10 milligram doses of that shit. Help with the swelling. Oh, what did I sign up for? Yesterday, I was not in a good mindset at all. I was really stressed, really anxious. I guess the sleep helped with that. And
Today's a little bit better, but I don't want to go home yet. I'll ask maybe for one more day, we'll see. I have a room to myself in this hospital. One bedroom. I'm very lucky. But, I'm getting discharged in a couple hours. I feel like it's too soon. I feel like a day would be better, or two. Because swelling is just gonna get worse. And I'm still calling the nurses every few hours for something. I just have to make sure, like, when is the last time they gave the pain meds and the antibiotics, just to make sure they're getting it. And, yeah, I'm still advocating for myself, which is frustrating. I wish there's more proactive care. I'm just walking down the hospital unit. I got the last dose of morphine, and I was feeling lots with my AA. I'm waiting for my mom to pick me up. I think it'd be nice to stay an extra day just in case. The swelling gets worse at day 3, I think. But it is what it is. And I'm walking. It's pretty better. I'm gonna make an appointment with my GP to get for Ativan and maybe trazodone. Maybe that help with sleep and stress. It's I'm just so dependent on the CPAP, and the surgeon doesn't want me to use CPAP because the air can cause emboli in the wound, and it's just, I feel like I'm gonna stop breathing and I get all energized, jolted up. So I need to calm it down, get used to sleeping without the CPAP. This is a nice hospital. 5-star hotel. I like being able to move around. Some nice paintings. Just walking around. No more paintings. Oh, that one looks nice. I'll show you that one. Oh, you're kind of boring. I don't like that. I need to go section soon. I'm full of stuff. That's the one I like. Look at that one. It's interesting. There's some wolves and sheets, and he's reading the days. Visual. Sheriffs are in a house. The house is very small. The house is smaller than the tractor. You see? I can't even see if you see. Oh, this is okay now. I just got a dose of morphine, so maybe that's why. I'm still walking with the hospital, so I need to go find my socks or shoes. I don't know where my shoes are. I was kind of hungry too. Maybe I'll finish my apple juice. My mom should be coming soon. What shoe was I in again? I forget. Oh. What was I gonna do? Here's the apple juice. Swallowing is hard. My throat is very numb, or it's sore. Just uncomfortable. Doing good. almost done. It's taking forever. One more. Why are juice boxes so... Oh man, it's like 2 more. Jesus. On that side. There's a bug over there. This better be the last one, I swear to God. No more. There's still some more.
Hello.
Hello.
Hi, Jeremy.
Yeah, what's up?
I'm Lloyd. I'm the dietitian.
That's good. Dietitian Vic here. Vic?
Lloyd.
Oh, I have no memory. My memory is horrible.
Oh, I
Lloyd.
see.
Okay, thank you.
Did the doctor mention what kind of diet? Probably.
Oh my gosh, the doctor says I should be eating steak, just cut it off. I'm like, bro, I can't even open my mouth.
Yeah.
I'm doing 30 meals at a time.
Oh, that can be quite difficult. Yeah. Do you have some elastics?
Yeah, I don't even know how to take the elastics out.
Yeah, I think that it's a doctor that will take out the elastics.
Huh?
It will be the doctor that would take out the elastics.
Oh, okay.
Okay, and right, I believe you're quite swollen, so it's quite hard to open your mouth and then eat anything, right? So for the next few weeks, we don't want you to be using your jaw to chew at all. It's like if you break your arm, we don't want you to be bearing weight on that arm. Same with your jaw.
Hey.
Did they take your blood already?
Not yet. They wanted to do the needle stick and everything, right?
Yeah.
I haven't seen that yet.
But, you know, that makes me like,
Some
okay,
nurse
that's
stuck herself with one of my needles.
Sorry?
A nurse stuck herself with the needle
Oh,
that
really?
they used on me. Yeah.
Oh, wow.
I don't think I have anything else, so it's okay. It's
Oh.
not good.
Yeah.
You know, the doctor says, like, I could be chewing soft food right after. Like pasta or, I don't know. I'm not going to do that because obviously I'm like
of
this,
course
right?
not. So on average, it takes around 4 weeks to be on a blenderized diet, which is a fluid diet, or this is consistency of the smoothie. So on average, it'd be 4 weeks. But sometimes people heal much quicker. Sometimes they heal much slower.
Wait, I didn't understand. So I'm going to be on the blended diet for 4 weeks, or it's going to be 4 weeks till I can get on the blended diet?
No, you'll be on a blended diet for 4 weeks.
Yeah, that seems much more realistic. Like I'm doing right now, right? With
Right.
the apple juice.
Right. So I have this handout.
Yeah, I know. Hey, do you have any insert or boost here you can give me? Just speak some over.
I can take a look at our kitchen. We don't really have very much on stock on the unit. Usually the kitchen sends it through the meal.
Okay.
Do you know when you might be going home?
An hour or two.
Okay. So I'll just get through this, and then if you have any questions, just let me know. You can stop me.
Thank you.
So on average, it'll be 4 weeks. Once the swelling goes down and the elastics are removed, and you can open your mouth a little bit, you can try the pureed foods, which is like the consistency of pudding or or an applesauce, but
Okay.
nothing lumps or bumps. You don't want to be chewing anything,
Oh.
right?
Okay. Okay.
And also for the first week, just because your
It's gonna be
wounds,
swollen really bad.
yeah, your wounds are quite fresh. We
Uh,
don't want you to be using a straw. That's why they gave you a syringe to use
Yeah,
for now, because we don't want that suction pressure to be opening up this.
Can you give me some more of these?
Yeah, I'll give you a bigger one.
Oh, I bought a 300 ml one at
Oh.
home. Yeah, it's gigantic from
Oh,
Amazon.
that's perfect.
But that's good too. Thank you.
Yeah,
Thank
you can just reuse this one as well.
Okay.
Um,
The small ones are helpful also.
Yeah, so you can just reuse that.
Okay.
Okay. Just for the first week or so, and then after the first week, you can use a straw.
Okay.
And then I also highlighted it's for your physician to tell you when you're okay to move on to the diet texture through diet textures. Okay. Once the doctor gives you the go ahead, you can try going through the diet texture slowly. First, the minced foods. So everything finely chopped, grated, moist, and nothing too hard.
He wants me to do that right away. He seems very aggressive with the progression in diet.
Yeah. Familiar. He's quite new to.
This province, at least.
Yeah. So I'm used to working with a different doctor.
Which one do you normally see?
Doctor. Every doctor does things differently, but this is what most doctors just advise me to that the progression would be. But again,
Dr. Cadilli says his fixations are so strong that I could basically eat soft, specialty food right after.
I see.
I don't think I'm going to do that. I'll just take it how it is,
Yeah,
because this is where I'm at right now, right?
Yeah, I think as long as you're maintaining your weight and you're getting enough nutrition, I think it's good to take it slow for now.
Okay.
And then just progress through your diet slowly. First is the mince, and then the softer foods to the regular foods. Usually that takes 1 or 2 weeks.
Okay.
Yeah. Okay. And then this handout just gives you some ideas of things that you can try on pureed, mince, and soft diets.
Cool.
Yeah, and see how you tolerate that. But
Okay.
overall, while you're in this diet, just try to avoid things that are hard, raw, or dried fruits and vegetables.
So I was thinking of eating an apple when I get home, followed by some almonds and some nuts.
No.
You think that's a good idea?
That wouldn't be a good idea.
Oh,
I think
okay.
you'll return back to us.
Oh no.
No. And you'll be on even worse diet, which is not good.
Okay.
Yeah. But yeah, you can have peanut butter, just not the crunchy ones. And then the yogurt you can have. I also would advise you to, at least for the first week, to try everything smooth. Avoid things that have seeds or smaller particles, so that they don't get stuck into your stitches and cause infections.
Okay.
Okay, so nothing like rice or berries, something like that.
Okay. Oh.
These are just tips and ideas, and I'll let you read
That's
through
awesome.
them.
Thank you so much. I was gonna ask you something, but I forgot.
Okay.
How do I clean my teeth? Do I do that at all?
It's I believe that it will be the nursing that will teach you how to do the hygiene and all of that. Okay.
Okay.
And this handout gives you some examples of pureed foods that you can try and buy.
Okay.
And it would be good just to have them in hand because pureeing foods by yourself takes quite a lot of time and energy. So just have it would be good to have them on hand just for snacking if you do get hungry, because and this one is just a bigger table than the other one.
Okay.
Very similar, and this one just gives you some ideas on how to prepare them as well.
Okay.
Especially the meat part. The meat part can be quite tricky, but you can find some recipes online just to find pureed dishes as well. Okay. As I mentioned, this is quite a difficult diet to be on if you're doing the fluid diet for 4 weeks, because it will take you time to eat and to prepare
Yeah,
food.
it took me like half an hour to finish this juice box.
Yeah, that's why we got you a bigger syringe,
That's
which
good.
is, and you also have a bigger syringe at home, which is great as well, right? But this handout just gives you some ideas on smoothies that you can make.
Cool.
Just mix and match just to make sure, because you, especially the next few weeks, just for the healing, you'll need some extra protein and as well as fluids, not only for healing but also to prevent constipation, right? Especially if you're on pain medications, which can cause constipation, right? If I would really advise you to just monitor your weight. You don't have to weigh yourself very often. Just like see if your clothes are not fitting as they used to, or if you see any visible signs that you're losing weight. Just if you are, I would advise maybe try eating smaller meals more often, or if preparing the food is the issue, making them in bigger batches and freezing them and just reheating them. Or you can also try protein shakes and boost and supplements, which I can try to find you some in the unit if they have any.
Very cool.
Okay. Any questions? I believe you have a follow-up next week with Dr. Kadili. You can ask them more questions if you do have more questions.
Sure.
But you can also call 811 and connect with Dietitian for the meantime as well.
Okay.
If you have any questions.
Thank you.
Okay.
First of all, Lloyd, right?
Yes.
Nice. Got it.
Okay. I'll try to find you some to boost.
Oh, thank you. Okay.
Are you calling?
What's up?
I thought you were calling. No?
I don't think so.
Okay.
Did I do it? I accident?
Must have accident, yeah.
Oh, sorry.
Great, thank you. It's a little warm in here.
Yeah.
I
It's
should
not
have.
horrible. Last night was cold. Is it nice outside?
Yes.
Okay. I don't know when my parents are gonna be here. When my mom is.
Sorry, I missed that.
I don't know when my mom is gonna be here.
Okay, well, that's all right. I'm sure it won't be too much longer. So I'd like to open the curtains.
Sure.
Is that okay?
Yeah, and the nurses should come take my blood, right?
Yeah, I've been calling them. You're not the only one that we need some relatively quick blood work on, so.
And then Lloyd was gonna try to poke me some booster insurance.
Perfect.
That'd be pretty sweet.
Yeah, we don't have a whole lot of that stuff. He can find it, but we don't. Okay, thank you.
So, when they were wheeling me to the OR room, it was just like, there's so many people in there. I don't even know who they all are. The anesthesiologists, the surgeons, some residents or something, nurse assistants. They're all friendly, but it was like a whole big thing. It was just kind of scary. I just lied down on the desk. I just started crying. I cracked a few jokes. I can't remember what I said. But it was crazy. This is ridiculous. And then right after, it was just really rough also. Oh man, this is not fun. I would not recommend it. Right now, it's at a 5 out of 10, you know? I was hoping it'd be 3. Definitely not hoping it'd be 6. It's only better from here, though. It's only gonna get better from here. I hope there's no stupid complications or anything. Like you put my teeth on kind of crooked. Do my teeth look crooked to you? Yeah, they kind of do. Like, what the fuck? Motherfucker. Whatever, as long as I can breathe while I sleep. Hey, vey. There's wires. I can't see them. They're on the side there. It looks like it's a little crooked. I can't open my mouth. This whole thing was just so stressful, so awful. I want to say it's over now, but it's not over yet. I still got months of recovery. Hopefully it gets better. I'm seeing the surgeon in a week. I don't know. I'm home now. I'm so tired. This has been so bad. So bad. My mom is getting very agitated, calling me an asshole on the way home. I'm in pain. We don't have any pain meds. I feel like all my trauma is activated right now. Every flashback. It's so hard. I keep ending up in new, most difficult situations in life. New love. This one is rough. You can see the dose deviation.
And it could be from the swelling, right? Having swelling. We'll see. This is water. Some more water?
Sure.
I'd like you to rinse with the salt water. Any more?
That's okay. June 29th. Going for a short walk with mom. My head hurts, my face hurts, but the rest of me feels kind of okay. My occlusion is very bad. I still have the elastic bands. Eating a bit more, drinking a bit more. Kind of thirsty right now. But just still using the syringes. I can't use without the syringes. Moving anything is very difficult. It's still with the nasal septal deviation. Can only breathe through one nostril, but that's all I really need, right? Drooling everywhere. I really wish I was in the hospital until now, you know. The swelling gets worse on day 3. Would have made all it is a lot easier. But at least I survived. I'm no longer shaking anymore. I got really scared. I took an Ativan last night to help me sleep. I was waking up every hour. I got Not a horrible sleep last night. I feel everything. Feel it, feel it, feel it. Little numb. Pins and needles, feel it. Feel it, feel it. I feel everything. What the hell? Everything was supposed to be numb. I don't feel very numb. Is it the 29th today?
I think it's the 30th today.
30th? So day 3?
Today's day 4.
The surgery should be day 0, right?
Thursday, Monday, Tuesday, Wednesday, Thursday, day 4.
But Monday is a day off.
Okay.
Day 0.
Oh, all right.
I don't know.
Yeah, I guess so. Yeah, you're right. Day 3.
So I think they say today is the worst. Isn't it?
Yeah. 3 to 5.
Huh.
I still have to say day 2nd was so bad.
Mm.
And now you seem to be making little improvements every day.
Went for a longer walk.
Do you notice
It's July 2nd today. I just went for a walk on SFU Mountain. I had a counselor's appointment. I thought it was at noon, but it's actually at 2. So I was a couple hours early. I got confused. So I'm just waiting at least a couple hours. And I'm tired, I'm sweaty. Feels like I might have had a little bit of like relapse a little bit. My airway's a bit closer today. Brings me some anxiety, and my nose is still pretty messed up. I can't breathe through my left nostril. I think there's a little bit of bruising. I don't know if you can see. Nice out today. Today isn't horrible, so I'm happy. Oh boy. I'm 184 pounds now, and I was 194 before the surgery. There's some bruising. I don't know if you can see. Can you see the bruising? I should shave. Oh well. Hey, it's Sunday the 3rd, July 3rd, and I slept a lot, but not consistently. Broken up, waking up every few hours, a bit sweaty, just drinking some water, taking some pain meds. I think I'm breathing through my nose better. The swelling's gone down, but you can see my nose is still pretty messed up. Like, I don't even know what's going on with that. It looks kind of crooked. I still can't breathe through this nostril that well, but maybe it's improving a little bit. What's really bad is my chin, and just it feels like there's a tension in my throat getting pulled from the genial advancement. It really triggers lots of anxiety. Makes me worry about swallowing and just how the healing is gonna go, and if like the muscle will detach from the bone or just get stretched, or I don't even know, like damage the nerve. I have some salivary gland damage. Yeah, the GTA was, I don't know if I would have done that if I had more time. Oh my gosh, my nose is so crooked. Yeah, this has been hard, but it's getting better, getting easier. So I shaved. That was an interesting experience. You can see the bruising much more visible. Very tight here. Oh, look. Breathing in my throat. Going for a walk. I think I'm sleeping better though. I feel much more rested. But holy, what an experience. Yeah, and the numbing is different. Like, I feel like it's different every day. Now I'm a lot more numb in my chin area. My chin is very tender. Still not sure if I'm happy about the genial tubercle advancement. I think, I don't know. This is very anxiety inducing. The jaw probably would have been good enough. And I don't know. It's just that tension whenever I talk or move my tongue. Doesn't feel quite right. When I swallow, when I talk. Oh boy. But the swelling is going down, right? My roommates say it looks much better. Breathing through my nose is better, but still kind of crooked. I'm just gonna go for a nice walk. It's kind of cool outside for a change. See if I can go to the gym. And I've lost like 10 pounds already. So that's kind of crazy. So looking forward to checking my lab values later. Anyways, have a good day. It's Sunday the 3rd, and I went for a walk. I went to the gym, and I had a pretty good workout. Still using very light weights, but I did some stuff, and I don't feel horrible. I don't feel completely horrible. So today feels like a big turning day. You know, about a week after things, I don't feel so traumatized, so mind blown or just destroyed anymore. Although it's still there, it's still scary. It's the 4th, it's a week after the surgery. Still swollen, still uneven. This black thing on my lip. Nose still crooked. I can breathe out of my nostrils, both of them more easily. But it's very uneven. And the septum is deviated still. I don't know if it'll change. Teeth, I don't know, kind of crooked. It's painful. Things are getting better. I've calmed down a lot. The chin procedure still triggers the hell out of me. There's just this tension, this pain, this bruised, uncomfortable feeling right here. And every time I swallow, I get like this tense, just cringe, nails on a chalkboard kind of feeling. I don't know if the chin was a good idea, but it's too late now. I don't think it's not reversible. I'm trying not to catastrophize or think about what's gonna happen in the future too much. You know, forget the nasal procedures, forget the high weight suspension and anything else. Forget the orthodontics, the braces, the going back to work. I'm just taking it easy. It's just been a week. Could take maybe up to 6 weeks to really start feeling better. But I I don't know. The sleep is still off and on. Like last night, I swear I slept like 14 hours. Or I was in bed for 14 hours. Just very restless. I think I did too much yesterday. I was a little bit energetic. I was feeling good. I went for like an hour and a half walk, and then I went to the gym, lifted some weights, and I went to a movie after. So I just tired myself out, and I was getting really lots of hypersalivation. I think the swelling had gotten worse. So I'm just taking it easy now. Today I just took it easy. I went for a walk with my mom. That's pretty much it. I'm getting really tired of, and sure, it's making my farts smell bad. It's the last day of antibiotics today, so that hopefully that'll help settle my stomach a little bit. My stomach's been a little bit restless. Still lost 10 pounds, I think. Well, I haven't weighed in the last couple days. I don't know if I can get any of it back. I'm trying to eat healthy. I meditate a little bit. I'm able to focus more. Just a little bit. My concentration is still not that great. And, yeah, I don't feel so bad anymore, so things are getting better every day. It's the 5th. I'm gonna see the surgeon tomorrow. Hopefully I'll get my bands taken off. I'll be able to open my mouth. And, like, I don't even know what to say to him, you know? I'm still really disturbed about the chin surgery. I don't like it, but what is he gonna do, right? Like, I don't think it's reversible. I don't think anything I talk to him, I'm not gonna get what I need. I'm not gonna get reassurance or relief. It happened. Maybe I'll ask about the hyoid suspension, what that's like, if he has experience, if it helps with the tension in my tongue, chin, neck area from moving the chin forward. I'll ask him about my crooked nose. I'll ask basically just what he did, what movements he did. He said going 12 millimeters forward in my upper jaw and less than that in my lower jaw, but he said there was some rotation he did. So I want the specifics, I guess. I don't know. just soothes my anxiety. But I just don't even know what to say. Like, bro, you broke me. Yeah, you cut me open and cracked me and destroyed me completely. And I hated you for it. I felt completely betrayed, completely raped. Like, what the fuck? And then, hey, I'm also sleeping kind of better now. So thanks for that. You bum. God freaking damn it. You kind of changed my life. You saved me. And it was just so goddamn painful. And I'm just kind of messed up right now. Crooked nose, messed up teeth, tongue, neck area, chin hurts. Numb. It's within the realm of expectations, I guess. It's not horrible. I am still alive. And I think my airways are much more open now. And go to sleep not horribly. So, you did this job. I don't know. I wish I stayed in the hospital for a couple more days. I wish the pain meds were given more regularly in a dosage form I could tolerate. Like the oral Tylenol solution was freaking nasty. Like, it like burned my throat and it just tasted so bad. Like, I couldn't even take a single dose of Tylenol. Like, my mom crushed the pill Tylenol and dissolved it in some Ensure, and that worked for us. The Ketorolac IV morphine they were given, it was pure, and I had to ask for it. Just, yeah, like 2, maybe 3 days, regular pain meds. It would have been awesome if he prayed with me. If he just, I guess he just minimized the severity of this surgery so much, maybe. He said, yeah, 3 weeks, you'll be fine. He said it's very realistic. It's realistic. I told him he paints a nice picture, and he says it's a very realistic picture. It depends how you describe the narrative. Like, this is like the worst week. This is the worst thing I've ever done. But, like, I mean, I've been having a horrible time for the last half year, so I guess I'll thank him for doing his best. And I don't want to traumatize the guy, because it's scary on his part also, taking on the vulnerability, the liability, and trying to help someone, even though you're hurting them while doing it. It must be very difficult. So it's the 6th today, and I just saw him with the surgeon. Says things are looking good. Ooh, very bruised. The jaws feel fine. It's the tension in my tongue that's just, and the chin is just stressing me out. Every time I swallow, I cringe and tense up. And I think generally I'm sleeping better. I'm not using a CPAP anymore, obviously, but last night wasn't that great. I got like 9 hours of sleep, and I woke up a little with my headache and, you know, just dark lines in my eyes, not feeling that great. I might have slept on my back for part of the night though, so I still feel like I obstruct when I'm on my back. the meeting with the surgeon is good. He talked about how things will remodel and just kind of heal and fix themselves. He said he talked about the genial tubercle advancements, where they cut the square and pull it forward and twist it and nail it back in. It's just a little bit ew when I even think about it. But he said, yeah, he takes out the outer cortical bone, the bone marrow, and then the inner bone he pulls and then he twists. And he says that things will stretch out and I'll become used to it in a few months. And the bone will heal and remodel, the muscle will remodel itself. So not to worry on that. So just have to be patient. He said if there's a study, you'd want to do the sleep study in 6 months after the surgery. I don't know if I'll wait 6 months, maybe 3 months or even less than that. And then in 5 more weeks, so at week 6, I'll get the screws taken out, the bands taken off. He said I could take the bands off and put them on myself if I want to try eating. I don't know, maybe I'll try doing that, but it's actually kind of tricky to take the bands off. I had some trouble. I just took one off once and it was a bit difficult. Yeah, so things are getting better every day. I painted for the first time yesterday and I had a good workout. I think I'm gonna go back to sleep and take a nap when I get home though.
Hey, it's June 7th. I went to bed at 9 yesterday and I woke up at 7 today. And just woke up with a headache, not feeling good. I woke up in the middle of the night, late night last night at 2, and I just couldn't go to bed until like 3. So I took an Ativan, and I just don't feel that rested. The fact that I can sleep through the night without the CPAP at all is demonstration that the jaw surgery had an effect. But I still think I have some residual apneas. I think it might have initially it might have been more clear right after the surgery, and then there might have been like a relapse, maybe of soft tissue. Not sure. But yeah, I'm able to still obstruct myself, like with my tongue or just relaxing my throat. Yeah. I think my anatomy is difficult. First of all, with the orthodontics, the 4 teeth they took out in the front, I moved everything back. That messed things up, but also just like, I have a very big tongue. So in conjunction with the smalling, my arch, my bite, and it just stuffed my tongue in there, and it's like, what are you gonna do? It's just too big. I'm trying to remember. I think that orthodontist also mentioned like, oh yeah, you just get a chunk of your tongue taken out, like a midline glossectomy. I don't know what the evidence for midline glossectomies are, but it seems like a very invasive and horrendous procedure. So maybe I'll look into that. Maybe look into more hyoid suspensions. Just pinch a tent in my throat, keep the airway open. I think I like that idea. Maybe look into the throat nerve stimulating a device. Maybe I can do one of those at the same time as they fix my nose. But yeah, I'm happy. I'm feeling better. I had a good workout yesterday. I'm gonna go to the gym soon. Right now. I'm gonna get some chores done. I made a to-do list. I'm like, oh, I can do things now. What should I do? So kind of reorientating on life a little bit. Yeah, a little bit bruised still, but pain is almost gone. Very manageable. Maybe like a 2. And the chin isn't bothering me too much today. It's getting better. But still got the dark lines. Still, the sleep is a pain in the friggin' butt. I wish I had those 4 pre-teeth stayed in and they palatal expanded me instead. Oh, man.
Hey, it's still June 7th, and yeah, today's good. I went to the gym, had a good workout. Did some chores at the library. You can see the swelling is going down. I almost look like normal, or new normal. I took a nap around noon. Then I went off to buy some groceries because all the soup my mom made me is running out. So I figured I want to make some my soup now. I have some energy, so that'd be a good idea. I went to Walmart and I got this amazing blender, this thing here. And here's the top part. And it has 1200 watts. My old smoothie maker had about like 180. So it's like I was gonna say it's an order of magnitude more, but it's so powerful. I just press a button and it just destroys everything. And I have to be careful with it. The old one was like the little engine that could. It was like, boo, boo. This one's like, oh my god! I'm kind of scared of it. And I don't know. I just made some random soup. I put 2 chicken breasts. I put 2 broccoli, a giant carrot. Oh, I forgot to get celery. I put half a squash. Here's the soup. It's kind of green. Put an onion. I should put some spices in it. But yeah, life is good. Getting things back together again, thinking about work. My pain and discomfort is very diminished right now. I feel like pretty soon I can get off the drugs. Although I still want to get back on the CPAP and just see if that helps. I'm going to try weight off. I texted my surgeon. He says he likes the rap video I made. And he said, yeah, just do the sleep study first and then take it from there. So, yeah, things are good. So I took the elastic bands off just to test it. And talking is a lot easier. Still sound kind of weird though. And yeah, I don't have much mobility at all in my jaw. Like, still have a fat tongue. So I'll do some exercises. I'll put the bands back on. So my mom got me a jade roller because she saw on YouTube it's supposed to help with inflammation, and I don't think it does anything, but I think it's really cute, and it kind of feels good, and it feels like every time I roll my face, it's like I'm rolling. I don't even know how to say it. Like, I feel my mom's love when I roll my face with this silly roller. It feels kind of good. It's relaxing. Hey, another night with bad sleep. I'm tired and I'm pissed off. It's July 8th in the morning. And yeah, I just woke up in the middle of the night and tried to go back to sleep and tried to meditate, relax for a couple hours. Didn't work, so I took one of the Ativan I have left over from just the initial prescription after the surgery. And yeah, I'm just waking up with like a headache and just feeling foggy and just angry. What the heck? So I think I'm just gonna try to go back on the CPAP and see if that helps. Hopefully, like, the surgery would make me a responder now. And I don't know, people saying I need to cut down on weight, and I've already lost like 10 pounds since the surgery a couple weeks ago. And my BMI is not that high, so I'm just, I mean, I can't function like that. And I need to get on with my life. I was gonna, today was a cleaning day. Yesterday was good functionally. I did exercise and cooking and chores. But today I'm not gonna be able to do much. Yeah, so today was a pretty shitty day. Just slept horribly and just woke up really grumpy and irritated because it's just like, what the hell, man? This surgery was supposed to fix everything. So there you go. I got my expectations disappointed a little bit. And yeah, I went on a little bit of a bender. I drove to my parents' house and I'm like, I need my CPAP. I need my CPAP right now. I'm calling and texting my mom. She's at work. Where did you put my CPAP? She friggin' hid my CPAP in my brother's closet. I'm like, why did you hide my CPAP? It's not like it's like drugs or something. It's so I can breathe when I sleep. It's because like in the hospital they said it could like get in the way of like healing or something. But I texted my surgeon and he's like, you probably want to do the sleep study, see where you're at. But like, yeah, you can go back, you can use the CPAP. And I had I also had a call with a sleep doc today, and I told him I got the surgery done. He's like, oh, you're very brave. Like, it's only as bad as having a baby. It's almost as bad, no big deal. And yeah, it was bad. But he's booking me in for a overnight sleep study in September. So what is it? July, August, September, in a couple of months, which is perfect. And he said I can use the CPAP again, try it out, see if it works. And then I went to see my GP also, and he gave me a sleep aid because he gave me some lorazepam for anxiety for the surgery and stress, and that's been helping. But I don't want to use that for sleep. It like messes up the sleep, and it doesn't last that long either. So I'm trying out some trazodone, low dose, and see if that can help. So it's really about like control and fear, you know. I'm just so scared. Like, what the hell, man? This jaw surgery was supposed to work, and I'm still having residual symptoms, and it pisses me off. So I'm trying to do all these things to control the outcome. I'm like thinking about like midline glossectomy because it's probably still my tongue that's really fat and that's obstructing. I can subjectively feel myself obstructing, you know, when I relax my tongue. And I googled myofunctional therapy places. I found some place in Langley. They put me on the wait list, and I called a couple friends and got some support. And yeah, I'm really catastrophizing. We're just looking at all the danger and stuff. I'm just wondering what my AHI is. You know, I feel like I've won the lottery in terms of like a success is 50% reduction, and it's like 85 to 100% of people with the jaw surgery get the success. And I had a very large advancement also. So like, if my AHI is initially it was 22. If it's less, it's not. If it's not 11, if it's higher than 11, I must have won like some lottery to like have like the worst possible outcomes, you know. And I wanted a large advancement to get the cure, the 30 to 40% cure rate, where the AHI goes less than 5. So it's just like, man, fuck that. That's not cool. That's not what I wanted. Things are better now, but they're not as good as I wanted them to be. But that's a very negative way to look at things. And I mean, I've had a couple good days lately, and I was very, very happy recently, except these last 2 days. And I made some soup yesterday, and I had some good workouts. And I'm going for a walk right now, so things could be a lot worse. But damn, they could be a lot better too. Friggin' stupid thing. What else do I need to get cut off to be able to sleep properly? Yeah, so that's where I'm at today. I'm gonna try sleeping with the CPAP, maybe with that new sleep med, and I'm very hopeful that that's gonna work.
An incident. It's been going on all day, and talk about some hacking.
Ah.
So who were you able to text? You actually texted somebody today.
I'm texting people all day long, Alex. I'm with Belle. I don't know if that matters. Look at me. I took my elastics off. I'm going to eat non-liquid food for the first time since the surgery, since June 27th. And it's July 9th now, right? I can't open my mouth very well. I don't like this. I can't chew. It's very hard, Alex.
I'm gonna have my salad.
Maybe if I take little spoonfuls. I probably should have put some heat on my jaw before I tried to do this.
What's that?
I should have used some heat. They're saying heat's good as well as the ice. This isn't really working. No. But I want to finish it, just little by little. My face muscles are tired.
Feta cheese. If you find a place
Hmm?
that sells feta cheese on sale, I mean,
I'm not even chewing, I'm just swallowing it. This experiment has been a failure.
no man.
Save-On has feta cheese, doesn't it?
I want from a Mediterranean store.
I'm just shoveling it into my face. I'm not even chewing it. The bruising's gone down.
Your mom has a point. Back to CPAP and
Well, if I need it, I need it, right? If I need another surgery, then I'll get another surgery.
well, it's maybe can be like a one-off.
What do you mean
You
one off?
slept fine. After
No, it's been a couple. It's
surgery.
been a couple days. I didn't sleep fine after the surgery. It's been off and on. There's been some good days, but the last couple days were so bad. Nice salad. Yeah, I got feta cheese from Save-On Foods before.
What?
I got feta cheese from Save-On's before.
Yeah.
I don't know if it's up to your standards though. You have very high standards.
Goat.
Oh, maybe. I'll keep my eye open. I think I'm getting a little bit better at this.
Huh? Oh yeah. Well,
Did you try the smoothie already? The smoothie maker?
No.
Are you too scared? Why? Try it out. Let me know if you need any help or if you have questions how it works. Or if you want to use the old one is just in the drawer downstairs. Hey, it's Saturday, July 9th, and I used the CPAP for the first time since before the surgery last night, and yeah, I think I slept better than the last couple days. I still woke up frequently, and yeah, but I just worked out. I had a good workout, and I feel like I'm a little bit more functional today. I'm gonna go to the library and do some studying. And oh my gosh! So I'm using heat also for the first time instead of ice. You know, I was just icing it every day. It felt good, but I feel like I'm almost like I feel very back to normal now, almost pretty much. And yeah, someone said heat's a good idea, bring some movement back into the jaw. So I took the elastics off, so I'm gonna heat everything up. Maybe try to do some just movement. And this thing, you can ice this heater. You can put it in the freezer and heat it, cool it, or put it in the microwave and heat it up. And it's so much more powerful as when it's hot. You know, when it's I put it in the freezer, I take it out and it gets warm in like 5 minutes, and it's just like whatever. But I put it in the microwave and it's just like it's burning my face. It's burning my face. Oh, that's good. Still dealing with some disappointment from the surgery, but yeah, I'm feeling good after the workout. And hell, if it can make the CPAP tolerable and make me functional in conjunction with the CPAP, then hell, that's good enough. And things could always get worse. The surgery went well. Everything went well. It was a success. The surgeon did exactly what he needed to do, and yeah, maybe it's just my anatomy and the premolar shit and the macroglossia. My tongue is super big. That's causing issues. I just have some challenging anatomy. And friends said I should still try to lose some weight. You know, I'm back to baseline now. I was 180 pounds for years, but I don't even know if I can go any lighter than that. Like, that'd be before I started working out, and I'm still gaining strength back. So, what the hell? Let's lose some weight while gaining strength. That's fine. My new roommate's a nutritionist, really into bodybuilding, and he's like motivating me to do calorie counting and plan everything out. And I tried that in the past, and it just never worked for me. I was never able to be consistent with it, and I just never got the results for the effort that I put into it. So it was kind of like negative reinforcement. So I'm motivated now to try again. I'm documenting everything I've eaten so far. I'm gonna make a log and count how many. I'll count all my macros, all the calories I need, grams, fat, and protein. I remember how to do that. There's guides online. You can kind of see how my nose is a little bit crooked. It's like doot. There's like a doot, 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 doot. Yeah, that is what it is. And I'm obsessing a little bit about further procedures. What else can I do? You know, I'm 2 weeks out of getting half my face cut off, and I'm already rearing to go back in and get more stuff cut out of me. That's crazy. But it didn't work, goddammit, and I'm so sick of this shit. Like, I feel like I had a brief glimpse of what it is to be like normal, without normal functionality, and just be healthy, and just being able to do what I want to do. And man, it was freaking awesome. I want that. I want to be like that. I don't want everything to be so hard all the time. I don't want to be so impaired. I want ease. I want everything to be easy and accessible. and it's not. I don't think that's not. I don't think it's not realistic. I think it's realistic to expect that, and or to hope for it, or to work towards it at least. But I'm also grateful for what I have now. So my mindset's in a much better place today than yesterday. Yesterday was challenging. Kind of interesting to see how wide I can open my mouth, how things look different. Hey, it's July 10, and I didn't sleep good last night again. I was trying to make some changes. I stopped all the pain meds, except Tylenol, just plain Tylenol. No more NSAIDs, Advil, naproxen, none of that. No Tramacet. Took a few of those for a while, and I was also trying to cut down on the CBD oil. I think it might be too soon for that one. Yeah, I was. I guess I'm just getting readjusted to like the new normal still, and I was just really like obsessing about just everything. I guess. I think there was like a 40% chance of cure with AHI below 5, and I don't think I got that. I can't sleep without my CPAP, and I'm still affected. And then there was an 85% chance, plus chance of success, which is a 50% reduction in AHI. And I'm not even sure if I got that, If I had to subjectively say how much things are better now, I'd say 30%. So I'm one unlucky motherfucker. I missed the cure, I missed even success, but it did have a positive effect, so I'm grateful. I'm grateful that things didn't turn out worse. The pulling, the tension in my chin when I swallow, like the cringe, stress, anxiety, uncomfortableness of like having the rectangle pull forward twisted and just worried about how it's gonna heal. That's resolved. I'm not too. It's not the tension isn't there anymore in my tongue base, chin area. And when I met with the surgeon, he said that things remodel and it's gonna heal fine. It'll get like everything will go back to kind of not normal, but it'll heal properly. And I don't know. The word remodeling made me feel better. I don't look horrible. If anything, I wish that lower jaw was moved a little bit more forward and the upper one is a little bit more back. I feel like that upper, I don't know. I think it's overall neutral. Appearance change. And maybe I'm just being a little bit perfectionistic with wishing the lower jaw was a bit more forward and the upper jaw is a little bit more back. But it's based on where my teeth are, I guess. Now, and that's another thing I'm obsessing about. If I had orthodontics in, with the orthodontist coordinating where the teeth are and how the jaws would move, would that have made a better outcome? Because with the lower jaw moving forward, that's I think the sticking point for me, because my obstruction is very retrolingual, So if I'd had a bigger lower jaw advancement, would that have been better? And the surgeon said the lower jaw follows the upper jaw, and he did like 13 millimeters, which is quite large on the upper jaw, but there was also rotation. And then I'm looking in the mirror, and I think I can see kind of like the rotation. Things are much more, I guess it turned back a little bit. I'm not sure about that one. Other things, I'm just, yeah, so where do I go from here, right? Lingual procedures, there's the midline glossectomy, the hyoid suspension. None of those sound good. I don't want to do either of those. And then I thought to myself, at first I stuck my tongue out, and then I'm like, things are very much more clear back in my throat. I like that. I can relax and not obstruct myself so much. So then I thought, what if I just reversed the orthodontics they did when I was 14 or 15 and get widen everything and get premolar implants put back in. And that's pretty freaking crazy. Like, it doesn't have any good evidence saying, well, first of all, it's very controversial. I don't know if there's any good studies saying that premolars cause OSA or worsen OSA. It's all like colloquial expert opinion kind of shit. But subjectively, I think that's the big thing for me. Like, I can cut up my tongue, like suspend my hyoid, but that's not resolving the underlying issue. And yeah, I looked up how much implants cost, and it's like $4,000 per tooth, even more. So I'm like, fuck, motherfucker. But in some ways, that almost made me feel good because there's a path forward. So this is what I'm thinking about when I'm trying to sleep. Pissed off with just sad, disappointed with how successful the most successful jaw option is jaw surgery, with the crazy advancement, and also where do I go from here? And yeah, last night was the third night in a row I had to take an Ativan just to go to sleep. My GP gave me some Ativan to cope with the stress and from the surgery, and I don't like that. It doesn't last. Well, first of all, it doesn't last very long, like 3-4 hours, and I wake up, and it's just not a good thing to become dependent on. So I'm gonna lean more on the CBD oil, and also titrate up my meditation. I'm able to meditate now. I am still functional. 30% is 30%. You know, I'm just grateful for the functionality. I'm also thinking about going back to work. Can I go back to work? I'm having one good day, 3 bad days. It's a difficult situation because this shit is expensive if I do the orthodontic implant route, or I could just have the orthodontics widen it and then I'll have the spaces there and just work and then gradually put the teeth back in. And I was also thinking that if I have the orthodontics to widen, I can get the dome distractional osteogenesis maxillary expansion with SARPI or MARPI surgically, or miniscrew assisted rapid palatal expansion. That could help nasal breathing, also help with the palatal widening. So yeah, I guess it's no wonder I'm not sleeping well. It's not only because of the OSA, it's also because of the crazy situation. So yeah, I meditated 15 minutes today. I found I was so tense, so tight. My mind kept coming back to the obsessing. So I'm just gonna try to grieve it out and just work on the meditation like it's a muscle. Just increase the volume and the intensity. Mostly focused awareness and body sensation, gradual relaxation, and there's self-compassion, metta, loving kindness. I worked out today. I'm at my parents' house. I'm going to do some studying. I have to renew my license to practice my job at the end of the month, and I need to document some continuing education courses. And I found a good course I'm going to do for 5 credits. So that's today. Hey. It's July 11th today. Looking a little red. I just put some heat on my face because I'm doing some jaw exercises, and I don't really know what I'm doing. I'm just opening and closing my mouth, moving my jaw from side to side There's getting some light in there. This actually looks pretty good. It's growing on me. So a little bit wider today, maybe. So not the best sleep yesterday. I didn't use Ativan though, so that's good. I'm just leaning on the CBD oil. And yeah, I slept from 11 to I woke up at 4 and I just lied in bed for a while. And well, that's kind of weird. Is there like an infinite, it's just going infinitely. You can see myself in the phone. That's crazy. What was I saying? I woke up at 11 to 4, and then I was just not doing anything until like 7 or 8, and then I woke up at 9:30, and I exercised, so I'm happy, and I'm not eating horrible today. Ate some soup. No pain meds today. First day, I had not even Tylenol. It doesn't hurt at all. It's there is discomfort. I'm feeling the sutures. I feel like my lips are being pulled up and down, and I just can't open my lips. Like you can see, kind of there, and kind of there, and there. The permanent. I think they're supposed to dissolve with time. So that's fine. And the numbness, it like for the first week or so, like it was changing every day, or I don't even know, week and a half or so. Like I could feel everything at the start, and then some parts were numb. So I feel everything here. There's just one spot. It was on my lower lip, but now I feel on my right here. So it's just like this little spot right here. Yep. But it's changing, and we'll see what happens with that. His nose a little bit crooked. Teeth still maloccluded, but whatever. I ate some solid food yesterday. My family had some chicken, butter chicken. I cut up in little pieces, and I was like, it was weird, but it was okay. I was gonna say something. I forgot what I was gonna say. I'll say it later when I remember. Oh yeah, I remembered. My teeth are numb, and that's a bit worrying to me. Not all of them. Just the front ones. So, yeah, here, and the lower ones is kind of like more tingly. I still feel those ones, but it's a little bit weird, and that's worrying, I think. When I was a young kid, like I was running around like crazy, like ADHD, and I used to like fall and smash my face a lot. I like injured these teeth, and I think they said I might need root canal, and that never was required. But yeah, I'm just worried. I'm hoping, yeah, it's like there's nothing there. So we'll see what happens with that.
Hey, it's July 12th, and it's about noon, and I'm just kind of confused. Like, I think I slept well last night. I'm not sure. It's strange, because I'm not used to it, maybe. Like, I went to bed at like 10, I fell asleep around 11, I woke up around 3, and lied there for an hour, went back to sleep at 4, woke up again at 8, And then I just felt so tired that I'm just like, oh, I'm just gonna go keep sleeping. It took me a while to get back to sleep, and I slept from like 9 to 11:30. So my sleep schedule is kind of messed up because I usually wake up around 8 and 9. But every time I woke up, I felt like I actually kind of had a decent quality sleep. And like over the weekend, I reached out to this other orthodontist that specializes or has some experience with treating OSA and premolar extraction retraction orthodontic patients. And he said he was talking about tongue tie and how like myofunctional therapy to make sure the tongue is on the roof of the mouth, MARPI, palatal expansion, and if all that doesn't work, then opening up the spaces again for those premolar implants. And I guess like I kind of like, where's my tongue? I kind of ask myself, what's it doing? And I think it just kind of gotten weak after, maybe it got weak for a number of reasons. I was using the tongue retaining device before the surgery, like that. And it's supposed to be suction at the roof of my mouth to kind of make some tone in the tongue base to keep it patent. I think that's the proper tongue resting tongue position. It's like there's a suction bringing it up. And my tongue was also tired after the surgery, especially with that rectangle pulling forward, the genial tubercle advancement. So I think I lost a lot of strength and tone. And so I guess last couple days, maybe just like last day or so, like I've been trying to do some tongue push-ups, tongue exercises. And last night I just really focused on keeping the suction at the roof of my mouth. And it's like it doesn't like to stay there. It's not that easy, I think. It flops down a lot. I feel like there's some bumps at the side of my my palate that makes it not want to suction easily. The widening might have helped with that, but with the widening, they usually do it before the MMA, and so I have like the Lafort 1 osteotomy that's still healing, right? So looks crooked. So I'd have to wait like a year before getting the palatal expansion for the Lafort 1 osteotomy to heal, because I want to do the MARPI, mini screw assisted expansion, to split the suture rather than surgically assisted, because surgically assisted, I think there's no nasal benefit, but with because you're doing the Lafort 1, so you're not really widening the nasal hole in the bone. But with the MARPI, the bone is still, the upper jaw is still fused to kind of like the sides, so it kind of like spreads apart a little bit. So I'm interested in that later on, and maybe getting a lingual frenectomy. Like I think I have a bit of tongue tie. I really noticed it when I was using the tongue retaining device. When I put my tongue out in my mouth, it always flopping down. It was like a strong pull to go back, and yeah, like I still woke up with like this headache though, and maybe it's a different headache from the OSA headache. Maybe it's like my brain is finally like regenerating a little bit. It's like, oh, sleep. Oh, that's good stuff. And yeah, still taking the CBD oil. I'm so grateful that it's actually a really good option, and it kind of works and agrees with me. There's like no side effects with that one, the CBD oil. Yeah, I'm just gonna be patient with it, because I want to titrate it down right away, but I'll be patient and go slow, and try to get stabilized so I can go back to work as soon as possible. Oh, I have the orthodontist that I reached out to that was competent also referred me to this myofunctional therapist. So I have an appointment with her within about an hour and a half. I'm excited for. Apparently she has like ties or trainings to like this really renowned like this Zorush Sagi or whatever, doctor or orthodontist person in the States who's very big with OSA, myofunctional therapy, palatal expansion, blah blah blah. He's like super pro, and she got trained by him. So, and her price is actually really good compared to some of the other myofunctional therapists that I've seen. So, I'm excited for that. I'm probably not gonna exercise today. I'm feeling really tired, even though I slept well. But I've been exercising. I went yesterday, even though I didn't sleep well, and I increased the weight on everything. So it's pretty awesome. I'm losing weight too. Gaining strength, losing weight, getting half my face cut off. It's nice. Okay, later. My mom got me this jade roller, and I thought it was the most ridiculous thing ever. But it actually feels good, you know? It's like I'm foam rolling my facial muscles. I feel like my facial muscles have gotten really tired. I just feel like they're fatigued. I have delayed onset muscle soreness in my face. I saw the myofunctional therapist yesterday. I had a good day yesterday. I went all the way into near downtown, and she had a almost similar story to me. She's an older lady. She had her 4 premolars taken out, and now she had really bad OSA and headaches and stuff. And she elected not to do the jaw surgery or anything else. She's doing braces just to move all her teeth forward, I think. I don't know. It's a very complicated story, and there's just a lot to talk about in that 1 hour. And I wanted to get like some sense of direction on what to do moving forward. And she just takes a long time for assessment. So she said she gave me these nasal prongs to keep my nose open because there's some valve collapse. And I'm like, oh, whatever. And then yeah, the only thing she was ready to prescribe was like mouth bubbles, like. Just to relax and stretch out the facial muscles, I guess, like, because I slept well last night too, so that's 2 days of sleeping well, and I'm like, oh my gosh, this is great. I feel like I'm cured. I'm still using the CPAP, and I think what changed is I just remembered that, yeah, the tongue is supposed to be at the top of the mouth, right? Top of the palate. It's like there's like a suction there. So I just focused on that, and I was trying to do some myofunctional therapy, like tongue push-ups, at the like pressing it to the roof of my mouth and flexing it for like 10 seconds, doing some reps of that, and tongue slides at the back of the palate. And that helped, but I think I really tired my tongue out, and I just worked out again today. I had a hard workout, and like my tongue base is sore, and that tension is coming back. So I need to really take it easy. And I think the lady's right. It's like she said, you don't want your tongue to detach itself, the muscle to detach itself. And I'm like, oh god. Like at first I thought she was full of crap, but then I'm like, I think I overdid it. So I need to relax a little bit. And also with the working out, you know, I just deloaded back to the bar, but like today I overhead pressed 25s on each side. And I did weighted pull-ups with 10 pounds, all those like sets of 8, 3 sets of 8, and then a front squat with a plate, 135 pounds. And yeah, when I'm lifting like that, like my facial muscles get tight, my tongue gets tight, so it's dangerous. So I just I'll just maintain or maybe even go down a little bit, and maybe take another rest day tomorrow. And yeah, 2 days ago I did bench press with also plate 135, and same with rows, barbell bent over barbell rows. So strength, and I'm like a little bit more than 2 weeks, so you need to take it more easy. I'm not preparing for a competition or anything. Yeah. That's it. Morning. It's the 14th today. I slept okay last night, but something scary happened. I think I mentioned yesterday. Feeling some discomfort, symptoms in my tongue area, maybe because I'm doing too many tongue exercises or trying to suck it too much to the top of my mouth while I sleep. And it's been helping to sleep. For 3 days now, I slept good. Count them, 3. It's amazing. If this keeps up, I'll be like a normal person. Although I'm still on the CPAP. So yeah, yesterday I just felt like more of like this tingling sensation in the back of my tongue, like in my throat, feeling like I needed to swallow. There was some pain. Yeah, just like more lingual obstruction. And that caused me to have like a huge anxiety, pretty much panic attack. I'm like, oh, my genial glossal muscle detached from the tubercle. Oh my gosh, I'm freaking out. And yeah, it went really bad. I tried to ground myself the best I could. But yeah, I ended up calling a few friends, and they said to reach out to the surgeon. But he was asleep at the time, and he didn't reply. I took an Atifen, and I increased the pressure, the minimum pressure on the CPAP, from 6 to 8. And then I went to sleep, and I noticed the CPAP, it titrated to much higher pressure than normal, so it ended up at 10. And the last little while since I've been using it, it's been sticking around 6 or 7. So there was something going on. And the surgeon called me today. He said like it's like a cable, like it's like a thick cable with multiple strands. So he says he doesn't think I detached anything. I might have detached a few strands, and to take it easy. And with all the movement, I might have like burst a blood vessel or something, and that can cause the inflammation and pain that I might be experiencing. So, oh geez, that really calmed me down. And he said there's not much we can do. If he says if I need more advancement, we can do the entire chin next time. But yeah, he said like if there's a research study and he was presenting my case, it would take up to 6 months for all the soft tissue to remodel itself. So I just need to be patient. Oh, great. That's difficult. So I'm not gonna lift weights today. I think I was being crazy. I wanted to like hit PRs 4 weeks after surgery. In my dreams. So just go for a walk, maybe. Do some passive stretching. Foam roll. And keep doing some chores and study. Oh, the ice feels good on my chin. I'm grateful that I'm sleeping better. I feel like I'm getting back to my normal self. My brain's working again. I can focus. I still don't know about my memory. Yeah, even now I just feel like this globus, this obstruction sensation, like there's something there I need to swallow behind my tongue. Ay vey. I'm just praying a lot because it's all I can do. And not be an idiot with my tongue push-ups and weightlifting. So, another lesson that's been thrown from my face. Be patient, goddammit. Stop rushing so much. Message received. Thank you. Goddamn. So I talked to the surgeon, and he said that the muscle is very strong, like a cord, and maybe I tore a few strands doing the exercise,
and the sucking to the tongue to the palate, but probably not the entire muscle, and might have burst like a blood vessel, causing some inflammation there. And just take it easy as the soft tissue changes and remodels, and it can take up to 6 months for everything to kind of settle in again. So just being patient, taking it easy. No exercise today. I'm gonna do nothing, just use my brain, trying to meditate, and it's difficult. I slept well. I took an out-of-end though. I kind of needed it. I have different traumatic flashbacks I get into. I try to name them all when I identify them, just to kind of be like know what's going on, what to do with these feeling states, kind of thing. And like I was in a really deep, this is it, I'm going to die state, flashback state. Where something innocuous, or not innocuous, but some sensation or some thought just triggers me. It's just like existential mortality, fear, and everything is gonna go wrong. And I was in it bad last night, and I did my best to handle it, but the Ativan did the heavy lifting. I slept well though, so I just move forward the best I can. And it's still there. I'm gonna go ice. It's the 15th, and I didn't sleep good. I don't feel good. Been getting a headache the last few days, and I feel like my face is just getting used to the changes. My muscle's tired, and yeah, my chin or my tongue kind of is sore and uncomfortable, and yeah, just not feeling good today. So I'm not gonna do any really exercise. Maybe I'll go for a walk or something, but it's low functional day. No studying or anything like that, or chores. Just being self-compassionate. Feeling frustrated because I wanted more. I wanted more than this. I'm feeling very uncomfortable in my mouth. My teeth, I feel like, are undergoing like orthodontic changes. Still numb. And yeah, the malocclusion. I don't like malocclusion. I like it when my teeth fit together well. It's uncomfortable.